Hello friends, welcome back to Complete Medical Coding. Today let's discuss few practice questions from the radiological session. It's very easy to score marks from the radiological section. Okay, you can score 100% from this section, but the thing is you need to identify what exactly is mentioned or if there is any combined codes or combined procedures done that can be coded as bundled. So make sure you understand the question, read the question carefully, and it's time saving section also. You don't have to you don't have to look for too much time. You don't have to waste too much time spending the questions for understanding the questions also. Okay, because the questions are very small. So anyway, if you are new to the channel, friends, please support me by subscribing to the channel. Let's move to the questions one by one. Let's move to the first question. A patient came to the radiology department of the hospital on Monday morning for CT study of the abdomen and pelvis. An unenhanced CT of the abdomen and enhanced CT of the pelvis was done on the same session and interpretation was also provided. What CPT codes are reported? So here the CT scan of abdomen and pelvis was done, but for the abdomen it was unenhanced CT, means without contrast, and for the pelvis it is with contrast. Enhanced CT means with contrast. Okay. When I had taken the radiological session before, I think I had mentioned about such type of questions. So let's move to the options. Let's check on the codes one by one. What's the first one? 74150. Open the CPT code book. 74150. That is computed tomography abdomen without contrast. This is only without contrast. I mean, only CT scan of the abdomen is mentioned in this code 74150. And what is 72193? As mentioned in the first option, second code 72193. CT pelvis with contrast. So we got CT scan of abdomen without contrast and CT of pelvis with contrast. Let's check the other options, because if there is any combined code, you have to always use the combined code. So always check for all the options. Okay. 74160. CT scan abdomen with contrast. 74160 is CT scan abdomen with contrast, but that is a wrong answer, because we need CT scan abdomen without contrast. Okay. So skip that one. What is 74178? Options C and D. 74178 and 74177. Let's look into those codes. 74178 and 74177. CT scan abdomen and pelvis. See, initially itself we got the combined CPT, the combined code. CT scan computed tomography abdomen and pelvis. 74177 is with contrast material. Means all together abdomen and pelvis with contrast material. No, that's not our question. What is 74178? CT scan CT scan of abdomen and pelvis without contrast material in one or both body regions, followed by contrast material and further sections in one or both body regions. So this is the exact CPT code. See, without contrast in one or both. It can be either one or both. Okay. So without contrast. It means initially without contrast is done. That is what is mentioned in our question. Initially it was without contrast for the abdomen, followed by with contrast material for the pelvis. So this will be our correct answer, 74178. See, I am just explaining it deeply so that those who doesn't know how to code such type of questions, such type of confusing options will be there. Combined codes will be there. Split options will be there. See, here we can say option A is correct and option C is correct, right? Both are having the same answers, but since there is a combined code, in option C 74178 CT scan of abdomen and pelvis. Since there is a combined code, you have to always use that code. This will be applicable when you will go for jobs also, jobs or interviews. You will get such type of questions. Okay, always use the bundle code. So 74178. Option C is the correct answer. Answer will be 74178. CT scan, abdomen and pelvis without contrast material followed by with the contrast material. Okay. Let's go to the second question. A 76-year-old female had a ground level fall when she tripped over her dog earlier this evening in her apartment. The emergency department took x-rays of the wrist in oblique and lateral views, which revealed a displaced distal radius fracture grade 1 open right wrist. What radiological service and ICD-10 codes should be reported? So here the patient, the female, had a fall on the ground level fall in her apartment, okay, when she tripped over her dog. Now, what are the procedures done? X-ray was done, okay, X-ray of the wrist was done, which shows X-ray of right wrist was done, which shows the distal radius fracture. Distal radius fracture, grade 1 open right wrist, means on the right wrist it shows a X-ray was done and it shows fracture, radius fracture of the right wrist, okay, open fracture. That is why it's mentioned grade 1 open fracture of the right wrist, radius of the right wrist. So we have to code the radiological service and the ICD code, okay. So let's move to the first option, CPT code 73100. What is 73100? Radiological examination of wrist, 2 views. Yes, the radiology department has done the radiological examination, X-ray of 2 views, wrist 2 views. Okay. And what is modifier 26? Professional component. So, because the X-ray was done in the emergency department itself, the same physician has done the, on the same hospital, on the same clinical setup, it has been done the X-ray. So, we will code it with modifier 26, professional component. If the physician has sent the patient to other, or if the physician has sent the patient outside for doing the X-ray, then it will be reported with the modifier TC, technical component. Okay. So here 26. We need radiological examination, wrist itself, right? If you want, you can check the other options also for the CPT code 73110. What is 73110? 3 views. Radiological examination complete 3 views. Now here only oblique and lateral views were done. So it means 2 views only was performed. And 73115 CPT code, it means wrist arthrography, radiological examination of wrist arthrography. This is not wrist arthrography, this is just radiological exam, X-ray only, okay. So our CPT code will be 73100 with modifier 26. Now let's look into the ICD codes. What is the first ICD code? S52.501B. S52.501B. Just open your ICD code book. I'll just explain how to code the 7th character. Okay. S52 point. You already know that A, D and S, right? The 7th character A represents initial encounter. 7th character D represents subsequent encounter. And 7th character S represents sequela. Apart from that, for fracture codes, for coding fractures, there are other alphabets also for representing open and closed fracture. Okay, that's how you need to code the fracture codes. I'll show you another slide how to code fracture codes. Anyway, just open the ICD code book S52.501B. What is S52.501B? S52.501B S52.501 is unspecified fracture of the lower end of the right radius. 501 is right radius. S52.502 is unspecified fracture of left radius. So we need the right one. I'm just explaining the other codes also. And if it is S52.509, it means fracture of lower end of unspecified radius. If nothing is mentioned in the question, you will be coding it as unspecified. But since here it's mentioned, already mentioned, right radius, you will use the code S52.501. Okay. There are other codes in the other options, which is not right because we already got the correct ICD code, right? And no need to look for other options because our exact CPT is 73100. So 73100 comes in options A and D. And in option D, what is S52.601B? S52.60 is unspecified fracture of lower end of ulna. This is not ulna, this is radius, already mentioned. Displaced distal radius. So this is radius. So our correct, we already got the correct answer as option A. But I'll just explain what are the, what is that ICD codes. Okay. So S52.501B is unspecified fracture of the lower end of the right radius. What is W18.31XA? We need to code the place and the last code Y92.039. So place of occurrence we need to code as well as the external cause of injury. What caused the injury or the external cause in which place? Okay, all these we need to code. So what is W18.31XA? W18.31XA represents fall on the same level due to stepping on an object, initial encounter. See here the seventh character is A, which means initial encounter. So fall on the same level. This is same level only, right, as her apartment. Ground level it is mentioned. Female had a ground level fall in her apartment. So it means her apartment was in the ground floor and on the same level she had the fall. So that's why this code is, that is what is described in this code. Fall on the same level due to stepping on an object. Initial encounter. And what is Y92.039? That is external cause of injury. Unspecified place in apartment as the place of occurrence. The place of occurrence of the external cause. Okay. Unspecified place in the apartment. So it was in the ground floor, ground level, and then in the apartment, the place. So I will explain you. So we already got the answer as option A for this question. Okay, 73100 with modifier 26. And you have to code the fracture S52.501B. The place with the ground level fall W18.31XA and then the place of occurrence Y92.039. I'll explain you how this seventh character comes in fracture codes in the next slide. Just look into this slide. See, this is the coding fracture for the seventh character. A represents initial encounter for closed fracture. If in the seventh character, if the seventh character is alphabet A, it means see A to C represents initial encounter. A to C represents initial encounter. D to R represents subsequent encounter and S represents sequela. So in that, A is the initial encounter for closed fracture. B represents initial encounter for open fracture type 1 or 2. In our question, it was mentioned open grade 1. Grade 1 open, right? So it means open fracture grade 1 or open fracture grade 2. For those cases, you have to put the seventh character as B, alphabet B. And for alphabet C, initial encounter for open fracture type 3A, 3B or 3C. So for fracture type 3, you have to code C. Okay. So always use A for the closed fracture, initial encounter closed fracture. And always use B for initial encounter, open fracture, grade 1 or 2. And C for open fracture, grade 3. Whether it is 3A, 3B or 3C. Understood? These three are mostly important, A, B and C alphabets. Now the remaining parts, the remaining alphabets, D to R represents subsequent encounter. So D represents subsequent encounter for closed fracture with routine healing. Always the first is the closed fracture. E represents subsequent encounter for open fracture type 1 or 2 with routine healing. F represents subsequent encounter for open fracture type 3A, 3B or 3C with routine healing. See, this will be the order. First closed fracture with routine healing. Then type 1 or 2 with routine healing. Then other two will be open, okay. And then third one, open type 3, either A, B or C. Routine healing. Now comes the delayed healing, G, H and J. So G, subsequent encounter for closed fracture with delayed healing. H, subsequent encounter for open fracture type 1 or 2 with delayed healing. J, subsequent encounter for open fracture type 3, A, B or C with delayed healing. Okay. So D, E, F is for routine healing, G, H, J for delayed healing. Now K, M, N, non-union. K, M, N for non-union. K for subsequent encounter closed fracture with non-union. M, subsequent encounter open fracture type 1 or 2 with non-union. N, subsequent encounter for open fracture type 3, A, B or C with non-union. Now P, Q, R for malunion. P, Q, R represents malunion. P, subsequent encounter for closed fracture with malunion. Q, subsequent encounter for open fracture type 1 or 2 with malunion. And R, subsequent encounter for open fracture type 3, A, B or C with the malunion. And S always represents the sequela. So this is how you have to code the fracture. It looks a little complicated, but it's very easy to understand. You mark it as like options, like 3 to 4 different stages. A to C, A, B, C represents just the fracture. Always the first one will be closed and the other two will be open. In that, the second one is open fracture type 1 or 2 and third one is open fracture type 3, A, B or C. And from alphabets D to F, D, E, F for routine healing, G, H, J for delayed healing, K, M, N for non-union, P, Q, R for malunion, and S always represents the sequela. Okay, so just we have to remember all this. Moving on to the third question. A CT density study is performed on at postmenopausal female to screen for osteoporosis. In today's visit, the bone density study will be performed on the spine. Which CPT code should be used? So here CT density study, bone density study is performed. CT density study on the spine, which was performed on the spine. What is 77075? Radiological examination, osseous survey, complete, axial and appendicular, skeleton. This is not osseous survey. So 77075 is wrong code. What is 77080? Dual energy X-ray absorptiometry, DXA, bone density study. This is not DXA bone density study. So that's also wrong. What is 77078? CT, computed tomography, bone mineral density study, one or more sites, axial skeleton, example hips, pelvis, spine. Yes, we need the spine. CT, bone density study. So this is the correct answer. Answer will be option C, 77078. CT density study, CT bone density study, one or more sites for the spine. That's why it's mentioned in the bracket. Example hips, pelvis and spine. So spine. 72020 is just an X-ray. So that's also not the correct. So answer is option C. Moving on to the fourth question. A 2-year-old presents to emergency department with right upper arm pain. Right humerus anterior or posterior and lateral views are obtained. No fracture, dislocation or other abnormality is seen. What CPT and ICD-10 CM codes are reported for the physician services? So here X-ray was done for right upper arm. Okay, right arm. And what is the diagnosis here? Right upper arm pain. The patient is having right upper arm pain. No other diagnosis, because after taking the X-ray, it was identified as no fracture, no dislocation, or no abnormality. If there is nothing, it means you have to code only the symptoms, right? So it means right upper arm pain is the diagnosis. Anyway, let's move to the options. So what is the right upper arm pain diagnosis? We will find it out first. What is the first ICD code? M79.621. So M79.621, if you can see, that represents pain in right upper arm. M79.621 represents pain in right upper arm, which is what we need. If you can see on the third option C, M79.601, it looks similar, right? But 601 represents just right arm pain. But in our question, it's clearly mentioned the right upper arm pain. So for upper arm pain, since you have the exact diagnosis M79.621, you have to code M79.621. And R93.8 ICD, that represents just abnormal findings on diagnostic image. Since we already got the correct one, the correct ICD, M79.621. Okay. What is CPT code? 73060. 73060 represents radiological examination humerus, minimum of 2 views. Yes, this is right humerus, anterior, posterior and lateral views. Anterior or posterior and lateral views. So 2 views. So right humerus, 2 views X-ray. So this is the correct CPT code 73060 with the modifier 26 because professional component. So our correct answer is option A, 73060 with modifier 26 and ICD code M79.621. Okay. Moving on to the fifth question. A patient presents for a mammogram to evaluate a suspicious lump that was found in her left breast during her recent annual exam. Computer algorithm analysis of the digital image was employed to detect the extent of the lesion. What CPT codes are reported? So here you have to code for the mammogram of left breast. It's a simple question, right? So just take the first CPT code 77066. 77066 means diagnostic mammography including computer aided detection when performed bilateral. This is not bilateral, this is unilateral because left breast. So you have to code for the unilateral code, which is 77065. Unilateral code. The option B, 77065. 77067 is screening mammography bilateral. That is also wrong. So our correct answer is diagnostic mammography unilateral. So 77065. Option B is the correct answer. Okay. So friends, these are few important guidelines and questions from the radiological section. If you find this video useful, please support me by liking and sharing this video. And if you are new to the channel, please subscribe to my channel and stay tuned for more videos. Thank you so much friends. Bye. Take care.